Imagine you're just going about your day, and suddenly you cough, and you see blood. Scary, right? It's something that would make anyone feel a little uneasy. But here's the thing, while coughing up blood can feel terrifying, it's not always a sign of something serious. Today, we're going to explore why this happens, what it might mean, and when you should take it seriously. What does it mean to cough up blood? When you see blood after coughing, the medical term is hemoptysis. Hemoptysis can result from many different things, from mild issues like a nosebleed to more serious lung conditions. But don't panic, let's break it down. Step 1, is it really from coughing? First things first, if you're coughing up blood, start by ruling out simpler explanations. Did you recently have a nosebleed, or could the blood be from a minor mouth injury? Sometimes, blood can flow from a nosebleed down the back of your throat while you're lying down, and when you wake up, it might come up as a bloody cough. If it's a small amount, that might be all it is. Common causes of coughing up blood. Now, let's look at some more specific reasons why you might see blood when you cough. We'll go from the more common causes to the less usual, so you know what to consider first. 1. Respiratory infections. Infections like bronchitis, laryngitis, or pneumonia are actually the most common reasons for coughing up blood. When you have a respiratory infection, your airways become inflamed, which can lead to blood in your cough. If you've recently had a cold, fever, or someone in your family has been sick, this could be a likely cause. Most of the time, infections like viral bronchitis will clear up on their own. But if it's bacterial, you might need antibiotics or even a hospital stay if it gets serious. 2. Asthma. Asthma is another common cause, especially during an asthma attack. People with asthma might experience coughing, wheezing, and shortness of breath. Though asthma doesn't have a cure, treatments like inhalers and lifestyle changes can make it manageable. If you're experiencing blood with your asthma symptoms, be sure to talk to a doctor. It might be time to adjust your treatment. 3. Chronic obstructive pulmonary disease, COPD. COPD is common among smokers and typically develops over years. You might notice a persistent cough, shortness of breath, and even chest tightness. While there isn't a cure for COPD, lifestyle changes, breathing treatments, and medication can help manage the symptoms. Blood in your cough with COPD could mean it's getting worse, so if you notice this, check in with your healthcare provider. 4. Lung cancer. Coughing up blood can sometimes be a sign of lung cancer, especially for individuals over 40 or those who smoke heavily. Symptoms might also include weight loss, fatigue, and a chronic cough. Although hearing the word cancer can be frightening, early detection can lead to more treatment options. If you experience symptoms like these, make an appointment to discuss them with your doctor. 5. Tuberculosis, TB. Worldwide, tuberculosis is a significant cause of coughing up blood. Although it's less common in wealthy countries, TB can affect anyone, especially people with compromised immune systems, like those with HIV. Symptoms include a chronic cough, weight loss, and night sweats. TB requires medical attention, often involving antibiotics, oxygen therapy, and other treatments, depending on its severity. 6. Blood vessel issues. Blood vessel problems, like a blood clot in the lungs or a pulmonary arteriovenous malformation, AVM, are rare but very serious. When a clot travels to the lungs, it can lead to a bloody cough and other severe symptoms like chest pain and confusion. An AVM is a malformation of the blood vessels that can rupture and cause sudden bleeding. These conditions are medical emergencies, and you should call 911 if you suspect a serious issue with your blood vessels. When should you call the doctor? Coughing up a small amount of blood isn't necessarily an emergency, but it's always worth mentioning to your doctor. Here are some specific situations that call for immediate medical attention. If the blood is coming in large quantities, not just a few specks. If you experience intense chest pain or trouble breathing. If you have a history of blood clots, or are already being treated for them. If you're feeling dizzy, confused, or even lose consciousness. If a baby or young child is coughing up blood or struggling to breathe. treatment and prevention. The treatment depends entirely on what's causing the blood in your cough. Let's break down some of the options. For infections, mild infections might just need rest, fluids, and over-the-counter meds. In the case of bacterial infections, your doctor might prescribe antibiotics. And for more severe infections like pneumonia, a hospital stay could be necessary. For asthma and COPD, you might need inhalers, steroids, or other medication to manage symptoms. Lifestyle changes, like quitting smoking or adding regular exercise, can also make a big difference in your overall health. For cancer, treatment could involve surgery to remove tumors, radiation, and chemotherapy. Early detection makes a huge difference in outcomes, so see your doctor if you have any of the warning signs. For tuberculosis, TB requires antibiotics, often for an extended period. Your doctor might also recommend oxygen therapy or other supportive treatments depending on the severity. For blood vessel problems, in an emergency, surgery or clot-dissolving medication might be needed. Long-term treatment can involve lifestyle changes, medication, and sometimes surgery to repair or manage damaged blood vessels. Final thoughts: don't ignore it. Seeing blood after a cough might feel scary, but it's your body's way of telling you something. Whether it's a simple nosebleed or a sign of something more serious, paying attention and knowing when to seek help is crucial. Remember, health is about staying informed and proactive, so make an appointment with your doctor if you're ever unsure. Thanks for watching, and stay healthy. Don't forget to subscribe for more helpful health tips and updates.
You